In the United States today, 34.2 million people are living with diabetes. In the United States today, 98 million are pre-diabetic. DNA testing is very important, right? DNA testing, genetics is important, right? And that's gonna definitely give me a great insight into your system. Like genetically, what does your body need? And we're all very different in that sense. And based on that, I can now put together a nutritional plan that your body is going to be receptive to. But it is possible to definitely reverse diabetes with the right plan, with the right toolkit for nutrition. It is very, very possible.
Welcome to Polish Your Life. Today, we're going to talk about type 2 diabetes, and to be specific, the functional medicine approach to type 2 diabetes. And I'm here with a very special guest. This is Dr. Kelechi. She is double board certified in family medicine and preventative medicine as well. And what's very unique about her as a practitioner is that she is combining what we know already that is so awesome in functional medicine. She's combining that with the medical model to help the patients achieve the best results as fast as possible. And she also makes it affordable. We had great conversations. I'm just super excited for today's interview. Dr. Kelechi, welcome to Polish Your Life.
Oh my goodness. Thank you, Mike. It's just such a pleasure to be here with you. I love collaborating with you. I love our energy, and it's just super honored just to be here in front of your audience. So thank you for having me.
Thank you. My pleasure. So let's talk about, maybe let's start with the concept of functional medicine. What is functional medicine? When we are talking about medical approach to functional medicine, because usually people see these two as two separate avenues. So it's the alternative medicine, and that's where people put functional medicine. And then we have the medical model where functional medicine is kind of like on the other side, where when we talk about it, we talk about integrative healthcare, and we talk about how can we combine them. So let's talk about your understanding about functional medicine and what it is.
Absolutely. Oh my goodness. I believe that functional medicine is really the best kept secret in medicine today. And that's not just my words, even the Cleveland Clinic says that right now. So we even have big mainstream clinical entities buying into this, but it's still a best kept secret. It's really a patient-centered, customized approach to wellness, where you're looking at the whole person. You're looking at the biological systems of the individual. You're not just focusing on the heart, the lungs, the kidney, the liver, right? You're looking at the whole person, and you're looking at their genetics. You're looking at their lifestyle. You're looking at their environment. And with all that information, you come together and create a plan. So it's also a collaborative approach. You come together with the patient, with the client, and create a plan that will take them from that disease model that they've been living in to a wellness model. So that's what I love about it.
That is so awesome. And it is the missing ingredient in healthcare, because many times we're going to look at one specific system. It may be, maybe circulatory system or another system. And we're just going to look at this one. But how our body works is pretty amazing, and everything is connected. Absolutely. Everything is connected. So being able to look at the whole body. And even I know that with you also talk about beyond the body. We talk about the spirit. We talk about having the mindfulness practice as the component of healing our body. It's so important, because now we can see the interaction of one system with another system, and then you're able to target something that may be a little bit more complex than just giving somebody a simple pill. I wish it was that easy, but it's not.
Right. And that is actually the problem, right? With the model of care that we have today. It's a pill for every ill. If you have hypertension, I give you this medication, lisinopril. If you have diabetes, I give you metformin. If you have Alzheimer's, I give you this. If you have, cancer, I give you chemo. And in one person, if you have arthritis, I give you prednisone. So in one individual, you could see 10 up to 20 pills. And that is just not sustainable. And that is just not functional, right? So this person is just tied down to illness, tied down to disease, right? We're putting, a Band-Aid in front of a bullet hole, right? And we're expecting the person to be well. So that is the beauty of functional medicine, is we're really getting to, the root. What is the cause? Not just treating the symptom, which is what I've been doing in the traditional medical model, right? It's just, and that's how it is set up. It is set up that way to focus on the system. It's not the fault of any particular provider or physician or practitioner. It is how our system was set up. It was really set for us to fail, because long term, it is no longer sustainable. So the beauty of functional medicine is now we're not looking at it that way. We're going really upstream, right? And we're trying to figure out exactly what caused the problem and not just cover it up with a simple another drug that does not really solve the problem. So that's the beauty of it.
That is awesome. That is really, really awesome. And I'm very curious. I'm going to give you a question that maybe you don't really answer too often, but knowing that we have standard of care to which you need to comply with all the rules, because you're board certified, double board certified medical doctor. And now we also have the functional medicine concepts that are working. What's
Right.
to me, it's super fascinating that you're combining these two. What I wanted to ask you is, what are some of the challenges when it comes to combining these two and integrating these two within your own practice, to not cross any line or to not do anything that would be beyond or against the traditional standard of care? What are some of the challenges in that?
That is such a great question, because the traditional standard of care is now becoming more acceptable that it's not working, right? So, you have to almost sprinkle it in and then let the patient move the needle. And they want more of this. They want more wellness. They don't want to be on 10. I literally prescribe 20 drugs and I know it's not working. So the challenge is going against the grain, going against the bureaucracy that says, no, you must order 90 pills every single 90 days. Just do it. Just refill, just refill, just refill. That is the model, because there's other self-interest in that. So you just have to say no. You just have to say no and know that you are now doing the best thing for your patient. And what motivates you is that you see the change. You see that people are getting better. You see the transformation. So it's truly about, digging deep and going into the reason you wanted to be a doctor, right? For me, it was about healing. And it's finally saying, you know what, enough is enough. Nearly 20 years of practicing conventional medicine and not seeing my patients getting better. And knowing now that we have a new way that we can do this and people are transforming, I'm doing it this way, and no, I'm not going back.
Wow. Wow. This is so powerful. And I appreciate you so much, because especially when you talk about all these years of practice, all these years of school, and then you are taught certain things, and then you evaluate the performance of the principles. And I think that many, many, many different things when it comes to conventional medicine are working amazingly, and we see them. And we also know that when it comes to, especially to chronic diseases, there's always that when I say always, I mean almost always, we see that challenge that we are really talking about management of the chronic disease versus trying to cure it or reverse it. And even mentioning that you could reverse a specific type of condition, maybe against the the narrative, and that is a little bit problematic. So I wanted to ask you, we're going to talk about diabetes or type 2 diabetes as an example of how you apply functional medicine concepts. So let's talk about the combo. What I'm very interested in hearing is, when we talk about this example of this chronic health condition that so many people have, and now functional medicine and medical model integrated, I would like to know not only what happens from the patient's perspective, what they will experience with you, but also what happens in your mind. If we kind of like switch seats and I'm in your head and you see the patient, what exactly happens? Let us know. And let's say this patient has type 2 diabetes. Let's talk about what it is, type 2 diabetes. And then let's talk about your treatment options that you choose.
Absolutely. Well, type 2 diabetes is basically a dysregulation and a failure of sugar metabolism, right? So and then it leads to chronic inflammation in multiple organ systems, from the pancreas to the liver, to the heart, to the endocrine system, to the cardiovascular system, to the nervous system. It affects the entire body. And it's a classic example of where we need to start. Just to add a little bit to this conversation, I was doing some, just updating my stats on diabetes. Take a look at this. In the United States today, 34.2 million people are living with diabetes. In the United States today, 98 million are pre-diabetic. In the US today, we're spending 327 billion with a B on diabetes.
I don't know if people realize, you said how many people are pre-diabetic?
98 million adults.
98 million adults.
And most don't know it.
This is a huge percentage of the whole population being pre-diabetic. I just want people to do the math and realize that when you look at the room of people, how many of them actually can be pre-diabetic or diabetic. So we're not talking about an isolated issue here.
We're not, right? And the issue with that is, I think the American Medical Association says in 2025, which is literally around the corner, right? We're in 2022. We're going to have a 90,000 physicians shortage in this country, 90,000. Okay. So this is no longer sustainable. The way we've been doing diabetes is just, there are no doctors anymore. So we got to start focusing on prevention. We got to start stopping it on the tracks, the pre-diabetes, so that it doesn't get to diabetes, where it's gonna be worse problem, because we're not gonna have those providers, the mid-levels and the physicians to take care of this problem. And then it's gonna be a bigger strain on the healthcare system, right? A bigger strain on the GDP, right? So it's just economic proportions that I can't even fathom. Is the train is already out of the barn, like the horse is out of the barn already, right? So it's pivotal that we now apply a different approach to this problem. So it starts with collaborating with the patient, right? You got to collaborate with the client, because my vision, I tell them my vision, and I see if it's their vision. I want to get alignment with my patient. If it's an alignment, then we go on the journey together. It is a process. And I tell my patients, my vision is to get you off of these medications. My vision is to reverse this process. My vision is to get you back to wellness. My vision is to get you back to your life. My vision is to live with vitality and to have a quality of life. Is that your vision?
Wow.
So first,
I don't think any doctor ever asked me a question like this, and how important it is, because when you have teamwork, you achieve results not only faster and better, you have better understanding, and you also have the pleasure of doing this together versus me versus my doctor. My doctor tells me take the pill. I say I don't want to take the pill. I mean, where is that going to take them? So I love what you just said. So collaboration with, even before you collaborate with the other providers, you collaborate with the patients as well, or a client.
Yes, because again, functional medicine, it's integrative, right? Which means, number one, it's functional. I want you to function. Just look at the root word of functional medicine. I don't want you to be diseased. I want to get you away from disease to wellness. So if I want you to function, it has to be one-on-one collaborative. Number two, if they agree with that, then we come up with a plan. And that's the beauty of functional medicine, is that now it is person-centered, right? Now I have the privilege of doing specific tests and studies that are going to tell me exactly what kind of nutrition works with your DNA, what kind of nutrition works with your genetics. I get to assess your environmental factors. What are the triggers, right? This is where I bring what I call Dr. Kelechi specialty, which is the 5R approach to taking care of your chronic disease. What are the triggers? How do we remove the triggers? What is in your environment? Because our environment right now is very obesogenic. There are no sidewalks, it's all highways, very little foot, you can't walk a lot of places, or unless you're in your own little community. So what are the triggers in your environment that are causing you to stay where you are? We got to identify what those are, because that's reality, right? I can have fancy plan and a fancy blueprint for you, but if I don't know what your triggers are that's causing you to stay where you are, then we're not getting very far. We're not making any headway. So once we identify those triggers, again, it's a partnership, one-on-one, to work on those triggers. Is it smoking? That has an increased risk of diabetes. Do we need to work on that as well? So it's full-centered. Then what are the deficiencies that you're missing? Again, functional medicine gives me those tools to be very specific for you. It customizes it to you. What are those deficiencies that you are missing that you didn't know about because no one ever told you? So it's not your fault. It's not your fault. You don't know what you don't know. But when I replace those deficiencies, whoa, but maybe the satiety is better. Whoa, maybe, you're taking in your nutrients better, right? Because now I've found those deficiencies and I've replaced them, right? Then we got to check your gut. That's the beauty of, diabetes. It's the perfect chronic disease for functional medicine because your gut is 90%, 80% of your immune system is your gut. And we know diabetes and immune system are tied hand in hand, right? There's a dysregulation in the immune system with diabetes, right? So we know that your gut, we got to heal the gut. We got to know what's going on in your gut, okay? If 80% of your immune system is in your gut and your gut is not healthy, we're not going very far. Mike, I can go on and on with the Kelechi difference, okay? Then once we put back those missing, probiotics that you need, the prebiotics that you need, we start to heal. We got to repair. Then we're repairing your gut lining. When we repair that lining, now the things that should not pass through do not pass through, right? We've repaired it. So then, there's so much that we're exposed to. And if the gut is not repaired, the inflammatory process continues, right? So I got to make sure I address inflammation, right? And finally, once we repair the gut lining, then we rebalance. Balance is really important to the whole psyche, to our wellness. That's where the mindfulness piece comes in. Rebalance involves sleep. Wow. Sleep is huge, very underrated in our society, right? We proud ourselves on not sleeping. And it continues that vicious cycle. So my last thing is rebalance. Where are we with sleep? How do we continue that nutrition that's customized to you? It could be ketogenic, it could be Mediterranean, whatever it is, we're going to tailor it to you because guess what? I have those special tools in my toolkit that's going to tell me exactly what you need to be doing in terms of your nutrition. So that's the Dr. Kelechi difference.
I love it. So I do have a question about nutrition because it is so, there are so many people who disagree when it comes to nutrition. And what's interesting is that everybody has their own point of view, backed up by statistics, backed up by science, which is almost impossible, but that's how we live our lives like this. So I just saw an interview with one of amazing people, with Bronson Dant, and about carnivore diet. So that's one of the extreme examples. And then another extreme example on the other side is going to be maybe being a vegan. And you look at these two completely separate approaches, and how is it possible that you have a lot of science behind one and a lot of science behind the other, and then there's also this whole rainbow of different colors in between? How do we customize it? So what you mentioned that is really important is you have different tools that you can use to get the patient better. So the patient comes to your office. Number one, we talk about the plan and the collaboration that together you and the patient are going to go forward. So I got that. And I think that commitment is very, very important. Number two, the way that I understand is that you're now using different tools to assess what the patient actually needs, right? So number one, testing, right? So what else?
So definitely testing, and that is going to identify what's missing, right? The stool tests,
the deficiencies you mentioned, right?
Yes, deficiencies, because we got to know if you remain deficient, I'm chasing my tail. Right. So those special tests, the stool test, the urine test, right, will tell me what deficiencies that you're missing that I must have in there as part of the plan, the treatment plan, to get you better, just in the whole body, the holistic approach, right? And then definitely DNA testing is very important, right? DNA testing, genetics is important, right? And that's going to definitely give me a great insight into your system. Like genetically, what does your body need to thrive? Because it's not a one size fits all. That's why, diets don't work. That's why, this popular weight loss programs don't work. It's a one size fits all. And we're all very different in that sense. And based on that, I can now put together a nutritional plan that your body is going to be receptive to. That's why, you can't give certain people lisinopril. You can't give certain people amlodipine because genetically that's never going to work with your blood pressure. The same thing is true for nutrition. Okay. So yes, there's a lot of science, but science, as we know, is open to interpretation, isn't it?
Of course, like everything in our life,
like everything else, right? It's open to interpretation, but it is possible to definitely reverse diabetes with the right plan, with the right toolkit for nutrition. It is very, very possible. And I've seen it. Absolutely.
That is amazing. That is truly remarkable, especially hearing that from a medical doctor is very promising, because what we do here in the group is we want to give people hope. And a lot of people, when they hear that, we have X amount of people with diabetes, it is, it's just basically, it's not your fault. And some people interpret that as like, so don't do anything because it's not your fault. It just happened to you. No. It's not your fault because you didn't know X, Y, and Z. But now that you see that there are solutions, it is actually on you as a patient to seek a proper, guide who is going to guide you towards possible solutions. So help me understand from your perspective when you're sitting in the functional / medical doctor seat, you see the patient, we have the collaboration about and the commitment to move forward with the plan. We are using different tools. One of them testing, and I know you use blood, stool, saliva, genetic testing, all kinds of like the whole spectrum, right? Number two, we were talking about nutrition. So many medical doctors don't pay too much attention when it comes to nutrition, but diet makes a big difference. Would you agree?
Diet is 80% of the problem. I just had a patient who I placed on a special meal plan, and the plan was for him, but he called me because his wife says she loves you because she's lost, 7 pounds in just 3 weeks on the plan that I gave him. So I love it. Nutrition is 80%. And this is a healthy gentleman in his 60s. He works out, he's retired, but he goes to the gym, he's lifting weights, but he just can't get rid of it because the nutrition wasn't right. So you can pump iron all day long, but if you go out and eat 2 hamburgers and you eat all the wrong things, it doesn't matter what you do in the gym. Okay. That's why gyms don't work if you don't pair it with the right nutritional approach. Okay. So definitely nutrition is the core of my practice. That's because it is about repairing the body. We are what we eat, because the body I have today is not the body I had 90 days ago, right? So we're always regenerating, we're always changing, we're always evolving, right? So what is creating that? It is what we eat, right? So it's really important to understand what works for you and what will not work for you and what you should never, never, ever touch based on the right information. So yes, Mike, to answer your question, we cannot go beyond go without getting the nutrition piece in order. Absolutely.
Super. And I know you customize that nutritional plan and recommendations. You customize to the specific patient based on the testing, not based on what you personally like to eat or what you personally like to recommend. So this is something I want people to understand, because in our group, in our community, we know this stuff. It's almost like the ABCs of healthcare, but I know some people don't really know. So nutrition and what you eat should be customized to you based on multiple different factors, personal preferences included, but you can have a personal preference filter put on what is good for you, and now you can eat something that you like to eat at the same time, something that is very good for you. So I love that. We have testing, we have the teamwork and collaboration with the patient. Let's talk about lifestyle just a little bit, because we talked about so much about that. So I want patients and providers watching to understand it.
I mean, think about it, right? Like in medical school, I got 1 hour of nutrition. So was I really set up? 1 hour.
1 hour, Jesus.
It was one afternoon. So maybe 1 to 4 max, like max. So with that level of information, am I now incentivized to coach my patients about the most important part of their health and wellness? Absolutely not. Okay, that's because and this is not the provider's fault. I didn't know either, right? I mean, I know that you got to eat right, but that's all I know is you got to eat right, whatever right is. And
Mhm.
in society, right is different for everybody, right?
Mhm.
So what is right for me may not be right for you.
Yes.
Okay. No longer calories in, calories out, because the environment is different. You know, we have food deserts. How much exercise you're getting is different, right? What your body needs is different. So if I, as a clinician, have only one afternoon of nutrition in my entire medical education, you know, it sets up a model that is focused on disease and not a model focused on wellness. Okay, because nutrition is key to really living that life of vitality. Nutrition is key to reversing those chronic diseases. So we are not set up to reverse disease, basically, is what I discovered way too late. And that's why I'm loving practicing this new model of care, right? We're not set up to reverse disease because we're not told that food is medicine. Okay. I can tell you so many instances, Mike, where when I code or bill for prevention, I get called into my superior's office that we don't get paid for that. What are you
What?
doing? Yes, we don't get
That
paid for
is
that.
just surreal.
What is this? Counseling. So that's why, you know, as clinicians, as primary care doctors, we spend so much time, or we try to, on counseling. It's not incentivized. I am not incentivized to prevent. I'm not incentivized to do wellness. Medicare gives me one visit a year for my Medicare patients for wellness. One. And that's the population that needs the most coaching. That's the population that has all these chronic diseases. And I'm giving one preventive health visit. Okay. Any other time, it's not going to be compensated. So now, are you incentivizing me or any other provider to do wellness when you can talk for 60 hours, but no one's going to pay you?
That is just crazy. And it's even it's so frustrating to even hear it, because, you know, we pay a very good amount of money. And when I say very good, I mean substantial. I don't mean that it's good for me to pay that much for health insurance, right? And that health insurance is supposed to cover the things that we need as patients. And knowing that it not only that it doesn't cover it, but also it almost like it goes against what patients need, it's very frustrating. So let's hope, because I'm always optimistic, let's hope that through interviews like this, we'll be able to change it a little bit. I wanted to ask you specifically diabetes, as a I wanted to touch on diabetes / metabolic syndrome, because a lot of people don't have never heard this term, and in the context of lifestyle changes. So if you could say what, like nutrition, of course, you will do the testing, you will team up with the patient, what lifestyle changes you like to recommend for people with diabetes, and what that metabolic syndrome actually means.
Yes. So metabolic syndrome is really multiple features. It is hypertension, it is waist circumference, you know, it is your level, your cholesterol, right? It's your BMI, right? So all these things, they got to come together as metabolic syndrome. So it's a syndrome, it's a spectrum, right? That we know that when you have this, it's the time to make that huge intervention, right? We don't want it to get to diabetes, but you're on the way. Okay. So lifestyle, we got to move. We're not a moving society, right? What happens is we don't move. We're sedentary. You know, we're genetically, we're created to move. So part of that lifestyle is we got to start getting people to get those steps in. It is pivotal, because what happens is with exercise is like an antioxidant for the body, right? Exercise is cleaning out the breakdown processes that happen in the body, right? So it becomes like an antioxidant. It cleans things up, right? It helps us to better regulate our metabolism, especially in the area of carbohydrate metabolism. Exercise helps the muscles and the organs take in your nutrients better, right? So it's a partnership. You got to do that with the whole process of with the nutrition to getting back to better. So lifestyle, movement is also medicine. Okay. Exercise does so many things besides being an antioxidant and helping us with our metabolism. It makes us feel better. It releases those natural endorphins, right? It clears our head, right?
Mhm.
It's mental, it's psychological wellness. So imagine a society, you're busy, busy, busy. You're not sleeping, you're eating all the wrong things, you're not exercising. How are we not going to fall into depression?
Especially now. And then they, you start spending more time at home because everything right now seems to be remote, and no incentive to move at all because I can have everybody in my laptop. So that is of course creating even more of that. I wanted to ask you just if you could go for 1 second, and I want to be respectful of people's time watching, but this is very interesting to me because with diabetes we talk about insulin so much. We talk about insulin resistance so much. I would like people to understand, if you go just for this 1 second, go one layer deeper and talk about exercise and diet in the context of insulin resistance, what it is and how do we fix it?
So it improves insulin resistance. So basically insulin is a hormone, right? It is when you eat a carbohydrate rich meal, when you eat a meal, you release a hormone. This hormone is what is required to allow you to use your nutrients as energy. Okay. And that's where carbohydrates come in. It gets converted to energy, right? So resistance is now when you eat this large bolus of food, your body's not doing what it's supposed to do. The insulin, it's resistant. So it's not, your body's not able to do what it's supposed to do with the nutrients that you eat, right? So you are not able to see those macronutrients. Your body does not know it's there. So you're resistant to the hormone that is supposed to help you use your macronutrients for energy, right? So when you're resistant to it, now I got to inject it to you. Okay. When I inject it to you, you can now use those macronutrients, the carbohydrates, for example, and you can put it away. So it becomes a storage hormone. That's why insulin is not good, because number one, when you're giving it as an injection, you're making people more obese because now they're just putting it away, right? So it becomes like a negative feedback loop. Okay. So with exercise, you improve on that resistance. You're able to use more of your nutrients naturally, requiring less of the chemical version of the insulin, the injectable form. So exercise reduces that resistance to your own natural ability to use your own insulin. Okay. So remember, diabetes is a dysregulation, is a failure of that whole insulin process, right? When we have diabetes, we're not able to release our own naturally, which is the best form of insulin is the one that you produce yourself. But over time, the system is overwhelmed. The nutrition is very, if your nutrition is poor and you're going down the path of prediabetes, because there's all this overload, right? It's overload. When there's overload, the system fails. Okay, there's an overload because the nutrition is bad. We're getting more weight. We're not eating the right foods. Too much carbohydrates. Too much this. Too much that. Right? The system gets it's overwhelmed and it shuts down. Okay, and then comes the pills that have their own side effects. Then comes the injections, the insulin that has its own side effects. Okay, it makes you put things away really fast, but it puts it away into your body, right? So it makes you even more obese. So insulin promotes obesity. So we are not doing it the right way. It's like we got to reverse engineer the process, right? It's literally putting a Band-Aid on a bullet hole, okay? Because that insulin that I'm giving you is making you obese, which is making everything not really better, okay? So we have to get away from just the hemoglobin A1C, which is a number, right? We're trying to get glycemic control, but the inflammatory process continues.
This is so amazing that, when we talk about functional medicine, doctors actually agree. What you're saying is so similar to what Dr. Brad Watts is saying about functional medicine. It's so similar to Dr. Trinka talking about functional medicine. It's so similar to other people talk. It's so similar because it makes sense. You need
It makes
to
sense.
customize, you need to look at the whole body and the whole
Right,
picture, even
right,
beyond the body, and you need
right.
to do all these things. So I want to tell everybody watching right now that with these videos, we are sharing information and we want people to be more aware that there are solutions, but we are not promising that your diabetes is going to be reversed. We can't promise that,
Mhm.
but there is definitely hope. And I
Definitely.
want you to know that there are solutions, there are people who can help. And
Right.
talking about Dr. Kelechi, because we have two types of people watching usually. It's the providers watching us. It's also individuals who are carefully searching for this next solution that may actually help their biggest problem. So when you talk to the providers, if you were to talk to these providers watching who maybe treat patients with diabetes and they want to connect with you,
Mhm.
what message do you have for them, and how they can connect with you?
Absolutely. I'm all about collaboration because, there's no one person that can do it alone. This is when you hit systems failure, it's all hands on deck. They can reach me at my website, drkalechimd.com, for future collaborations. They can certainly connect with you, Mike, and you can find me at all times. But
I'll find you. I'll
yeah,
find you.
they can put a message in the comment and we'll definitely
Mhm.
get back to them below, right? But yes, I love collaboration because everybody is needed. We need our nurse practitioners, we need our chiropractors, we need our physical therapists, we need our personal trainers. We need everybody on deck because this is a system problem that needs a system answer, a system-based approach.
When you mention the word system, it just means that it's organized.
Yeah.
It's something that we can actually look at, evaluate, and there is a process. There is a process that we need to follow. So I just personally, I'm very fascinated, hearing about and then witnessing this amazing way that healthcare can be practiced. I feel more people should do it. Everybody should do it. And the people who are maybe on the fence, I think a very good idea
Mhm.
is just to connect, to talk,
Yeah,
to ask questions.
absolutely. Yes, I agree. I'm just agreeing with you. Absolutely. Because it's even mainstream medicine is catching on. So I'm like, okay, great. And then they're now teaching it to medical schools.
So are you saying that functional medicine principles are now being incorporated to medical schools?
Yes, they're now being called in medical education. So for example, Cleveland,
Wow,
I know, I'm like, yes, they
this
got
is
on.
great.
This
This
is
is
great.
awesome.
We have to because of the fact that what we've been doing for the past 50 years has failed. So, we're now acknowledging this. And institutions are now starting to look at, okay, let's see how they do it and let's see what the results are. And it's looking really good. So, there are opportunities now where medical, it's been incorporated in medical education for both students and doctors in training. And I'm hoping that it happens more and more. And that's really my dream will be to teach this to more clinicians, because this is how we're going to reverse the problem is when we start doing it right. And we need more people doing it the right way.
I love what you said. It's looking good. It's looking
Yeah,
good. And that's what I want people to say, because there are different vibes. We can talk about
yeah,
the functional medicine, integrative healthcare approach. In the vibe, there's like, oh my God, everything is bad. Healthcare is messed up. It's not messed up. It's
yes,
fixing its own
yes,
flaws, right? We all have flaws because medicine is also created by people. We are not robots. We are not perfect. But
right.
if we can evaluate and with a conscious mind, and hopefully people somewhere on the top will just put, at least for a second, put that money aside. It's not just look at the patient. What does the patient need? And then reverse engineer what actually works. So you are giving the world great news. So we now know functional medicine is being brought in to be incorporated as part of mainstream healthcare. I love that. The more we see that, the more people are going to get better. And it's very important for us because like, our story and the reason why we are doing what we are doing, it is very meaningful. The diagnosis of type 2 diabetes, diagnosis of insulin resistance, autoimmune disorders, all the other chronic diseases. This is not a diagnosis for one person, it's for the whole family. And the whole family is experiencing pain and trying to look for solutions. So knowing that there are solutions there, and knowing that more and more of these solutions are coming here, is great news. And we always say there are people, and we all know at least one person like that they go from doctor to doctor. They follow recommendations, they still don't get better. And now what? Now what? So that is amazing that you now can connect through our group with all these practitioners. And guess what? None of us and none of you is perfect. So we are just trying to figure this out, but together is definitely much better. So definitely connect with Dr. Kelechi. Definitely connect with our other providers in our group. Follow us on social media. And why? Is because we have amazing providers like Dr. Kelechi. So if you're watching on YouTube, subscribe to our YouTube channel, share the video with other people. And if you have any questions and you feel like there's something that you would like to know, comment below, because maybe other people have the same question and it would be very, very good to know the answer. So we are happy to interact, connect. Dr. Kelechi, any last words to people?
There is definitely hope. There are definitely providers, clinicians out there who are doing this work. So, do the research, connect with this community right here. We have, Mike, you're doing amazing work, bring all of us together. And I can't thank you enough for what you do to bring this community together, because you've seen the light. And as lights, we must continue to shine and let others know that there is hope, and there is, we can get better, and we can fight chronic diseases like diabetes and hypertension and a slew of autoimmune disorders as well. There's just so much out there. There's so much work to be done, but there is hope, and communities like this and people like you are making it happen. So I just want to say thank you for what you do.
Oh, thank you. It is my pleasure, and it wouldn't be without people like yourself. So thank you so much. Thank you for watching, and yes, let's polish it so our lives can shine. Take care. All the best. Bye.
Bye-bye.